I'm Dr. Rajesh Taneja. I'm a senior consultant urology and robotic surgery, Indraprastha Apollo Hospital, Sarita Vihar, New Delhi. Today we will be talking about benign prostatic hyperplasia. So what is benign prostatic hyperplasia? Benign prostatic hyperplasia is a usual change that occurs with age in men. Men have prostate gland beneath their bladder. It is similar to something that women have as uterus. So the prostate gland starts growing in size in the third to fourth decade, and it starts troubling men by fifth decade of life. Benign hyperplasia of prostate means it is just an enlargement in the size of the cells and in the size of the gland overall. It does not mean that it is growing like another growth, which is usually termed as cancer. So benign prostatic hyperplasia is not a cancer. When does benign hyperplasia start? Benign hyperplasia starts from the third to fourth decade in life and starts increasing in number of cells, starts increasing the size of cells, and overall there is an increase in the size of the whole gland called the prostate gland. This is called benign hyperplasia of prostate. What are the warning signs of BPH? So when BPH starts enlarging in size, it causes irritation to the bladder. The first sign is frequent desire to pass urine. The second is that it is difficult to hold once you get a desire to pass urine. For example, if you are sitting watching a show of television or something else, you will need to go to the washroom without completing your job. And that is indeed the first sign of BPH. The other signs could be waking up at night to pass urine, which normally you don't do as an adult. What causes benign hyperplasia of prostate? Is it a cancer? So benign hyperplasia of prostate is caused by imbalance of hormones, the male and the female hormones. And as the age advances, there is a change in the ratio between the testosterone and the estrogen in the human body. And that is what is known to cause a trigger to increase the size of the prostate gland. It is just a size of the gland. It is not a new growth. Hence, it is not a cancer. We should not think that benign hyperplasia of prostate is actually a new growth. So, you should not be worried. It is not cancer. How common is BPH? Are there any risk factors? BPH is usually found in most of the men who cross the age of 30 to 40 years. So it is a histological. If you look at the prostates and look them under microscope, you will find changes of BPH. But clinically, that is, when does it start affecting, and does it affect all men? Almost 50% of men would have some effect of BPH in their lifestyle, but not all. So there is, as I said, there is just a change in the urinary system as the first sign. You have a frequent desire to pass urine, you have a difficulty in postponing urination, you need to wake up at night to pass urine. Is benign hyperplasia related to hormonal imbalance? Yes, benign hyperplasia of prostate is known to occur because of a hormonal imbalance, an imbalance between the ratio of testosterone and estrogen in men. Normally testosterone is at the peak in 20s, and then slowly it starts dropping. And that is the time when men start acquiring some fat, there is more of estrogen in the body. So an imbalance between the testosterone and the estrogen ratio is something that is known to trigger this change in the prostate gland. Can an enlarged prostate go back to normal? Usually not. The variation that we see on the reports on ultrasound about the size of the prostate is likely to be due to a difference in the technique used to measure the prostate size. It is extremely unusual for the prostate to regress on its own unless it has been treated with specific medication or there was a swelling once which reduced, and that swelling was an infection rather than the benign hyperplasia of prostate. Can the benign hyperplasia of prostate be cured? What is the best treatment for benign hyperplasia of prostate? So benign hyperplasia of prostate needs treatment only when it is troubling the people. For example, there will be so many men who would have an enlarged prostate on ultrasound, but they are not being bothered about it because it is not causing symptoms. So we don't need to treat these men. So we need to treat the men who have symptoms of the prostatic enlargement. We give medication which can reduce the size to some extent, which can reduce the symptoms to a large extent, but certainly calling it a cure is something which is far from difference. Only cure that you can talk about is when you surgically remove the prostate. Even then there may be a reappearance of prostate gland. So the term cure should not be used in such situation. Prostatic hyperplasia of prostate can be treated best with medications which reduce the size, which reduce the symptoms, and with laser which we can use to remove the obstructing part of the prostate and thus remove the symptoms altogether. So today we talked about benign hyperplasia of prostate. It occurs in all men but doesn't trouble all of them. So the men who get troubled with enlarged prostate or benign hyperplasia of prostate would seek treatment because they would need to have frequency of urination, urgency, and need to wake up at night to pass urine. There is no cure, but yes, the symptoms can be reduced with medication, and if it is causing obstruction, it can be removed with laser prostatectomy. That's all for about benign hyperplasia of prostate. Stay safe, stay healthy, and stay informed. If you find symptoms of enlarged prostate with you or somebody in the family, please consult a urologist.